have an important topic to discuss today. So today's theme is about health, longevity, and how to fight chronic diseases. So the startups that are presenting today are about that, how to make life longer, better, and happier. So today is the first our hybrid event. That means that we have people here in the room and we have people online who are also presenting and judging. So I'd like to thank our volunteers, both online and offline. We have Gian here, whom you met. Thank you so much, Gian. Thank you for your help. And
Jeremy, quick question. Hey, Jeremy, quick. Can you stop the sharing of the screen?
do this again, David?
Can you stop the sharing of your screen?
Sure. I would love to do that.
Okay.
Oh, David, I can see on the big screen now.
Yeah, start sharing it. I'm kidding.
So I didn't take my glasses today, so I need a bigger picture. Now it's way better for me. So I'd like to thank Procopio Law Firm for hosting us today and sponsoring this event. Roger, you're a long-time partner of Start Founder World, and we really appreciate our partnership. Would like to say a couple of words and kick it off?
Sure, why not?
Thank you.
At least our COO will know that I paid for dinner. Yeah, my name is Roger Rapport. I head up our Emerging Growth and Venture Capital Practice Group. We're a full-service law firm, AmLaw 200 offices here, San Diego, Phoenix, Las Vegas, DC, and I may have forgotten some other offices. 27 different practice groups. As I say, I head up the Emerging Growth and Venture Capital Practice Group, but one of my partners, Jeff Morton, is in the Life Sciences Practice Group. He actually heads up the Life Science Practice Group. And I'm actually going to ask him just to say a few words after me because there's a really important Supreme Court decision that it came down today that may affect some of you in the room. So yeah, I represent companies from the inception all the way through the IPO on the corporate side, corporate securities, M&A, and obviously financings are a very big part of my practice. There's a brochure on the seat. I just want to plug a couple of really important events. The one is the CEO Connect Roundtable. If you are in the life science, life tech, health tech industry, I really would encourage you to apply. It's a peer-to-peer group that meets once a month. It's going to be starting in June or July. We limit it to 20 CEOs. The moderator is David Crean, a really incredible individual with really deep domain expertise in the life science, health tech area. So if you're in therapeutics, devices, diagnostics, anything related to health tech, this is really an amazing program. The CEOs in the Southern California cohort just say they get so much out of it. It's a closed environment. You meet once a month. You talk about the issues that are really pressing in terms of conflict, in terms of scale, in terms of funding. So I really would encourage you to apply. Or if you know someone that you think would be a great CEO for the program, just nominate someone. You just scan the QR code on the back of that flyer. It'll give you all of the information related to the program. The other piece on the back of that is a funding workshop. I give workshops for founders and entrepreneurs. It's the third in the trilogy. It's all about negotiating term sheets. How many of you are in startups? Okay, looks like just about everybody's in a startup. I would imagine that at some point, if you haven't gone for funding, you will be going for funding. If you're independently wealthy and you're bootstrapped to exit, thank you. But for everybody else, this is a really important workshop. We go through 4 term sheets, SAFE, Note, Seed, and Series A term sheet. And I go through all of the provisions, the goal being that when you get to a term sheet, you understand the terms that will impact either your upside on exit or the control of the company. And it's a 4-hour workshop, so people say it's like drinking from a fire hose. but you'll have an 80-page workbook, after the event so that you'll be able to really kind of digest it afterwards. So that's next Wednesday night in this office here. So I'm just going to kick it over to Jeff, just say 2 minutes about the Supreme Court decision that was rendered today that may impact your patentability of what you're doing. Jeff.
Thanks, Roger, and very nice to meet you. And this will just be a quick addition to tonight. So there was a major biotech decision. Biotech doesn't go to the Supreme Court very often, but there was a major decision today in the Amgen and Sanofi case. And so essentially in a unanimous, which doesn't happen very often either, a 9-0 decision, they wiped out a bunch of antibody patents, very valuable patents owned by Amgen. And, this is probably going to be something that you'll be hearing about over the next few weeks and months. And, they'll be subject to, a couple hours of discussion, not 2 minutes. But the really big take-home message for anyone who's in the life science industry, the chemical arts industry, is that typically in patents, you identify 1 or 2 or 3 examples of the product that you're developing, whether it be a therapeutic or something like that, but you try to get broad claim language, broad coverage in your patents. And what the US Supreme Court decided today is essentially, if you're going to try to get broad coverage, you're going to have to demonstrate by way of examples all those different potential species within the broad claim set. So in the Amgen case, their claims have the potential to cover literally millions of variants of antibodies, but they provided about 26 examples. And so the idea was, no, you can't get coverage for 1 million with 26 examples. If you have 26 examples, you'll probably get around 26 coverage for around 26 antibodies. So this is going to, I think, have a very significant impact on how life science and chemical and other areas too, not just chemical arts and life science, but predominantly in that area, in terms of how they develop their IP strategy. And you're not going to be able to just go and try to carve out this massive picket fence in the IP landscape with a few examples. So the take home is go and speak to a top IP attorney. Our group at Procopio has at this point hundreds of years of experience doing work like this, but it will impact how you develop your IP strategy and how you also monitor third-party art by way of what's typically called freedom to operate. So the main point is there's been a pretty significant, I would say probably the biggest change in the life science industry in the last 50 years outside of subject matter eligibility. And if you're in this space, you're going to want to talk to someone who's really on top of it in terms of these changes. So with that, I will head back and thank you very much. Have a good night. Okay.
Thank you for sharing.
Thank you. Yeah. When Jeff told me that, I was like, but you got to tell him.
Yes.
Thank you so much, Jeff.
Yeah.
Thank you, Roger. So we also have got a special presentation today. Mind if I share back my deck? Oh, actually, that's me. My name is German. So today we also have a special presentation from Ehud Baron, the founder and the president of GT Cardio. Ehud is joining us online. I guess I need to stop sharing so that we can see Ehud. Hey Ehud, how are you doing? Can you hear us?
Oh yeah, I can hear.
Great. Would like me to share your deck or will you share it from your computer, which is more convenient for you?
Oh, you can share it.
Sure, okay. Almost there.
It's okay.
Here you go. The floor is yours.
Oh, thank you. So first, thank you all for having me. I'm talking now from Japan. And I think that this topic that I'm talking about is maybe only thing worth doing, which is cracking the longevity code, because this is what we all want. And we'll start with an example from the far past, 2,200 years ago. If you can switch to the next slide. This is a guy that was ruling China 2,200 years ago. He was the first emperor that unified China. And the reason that I mentioned him is that he, although he has everything in life, he was like the most powerful person on earth at that time, he wanted to be immortal. And he was obsessed with this. All the time he sent ships to find the immortals, try to find a potion for being immortal. And one of the interesting things that he sent this orders is that he got a lot of good recipes of good medicine to live better. Some very good Chinese medicine that we are still using today, but he ignored everything. He wanted to live forever. He didn't want some small improvement in health. And he chose something that actually killed him. It was mercury sulfide. And so he died at age 39. It's, of course, a very sad story, but I think it has a lot of an important lesson to what we are doing today. So today we will be looking for the current people that are searching for this potion. So if we can go to the next slide. This is just to give the background that you, of course, know. We spend a lot of years today in relatively healthy. And then when we get to 40, things start to get worse. So first is cancer, then cardiovascular, and so on. And around the 70, 80, Alzheimer takes hold. So we can see that this is a very, in a way, a very big warning. You need to do something when you are still able to do, to not to be on this curve, raising curve when you are old. And this is what we are trying to do in GT Cardio, the company that I founded. And this is what we say: if you don't want to be on this curve, high in the curve, with high risk when you get old, you need to start to work when you are 40 or even earlier, because all these diseases are developing over 20, 30 years. Next one.
It's too late.
So I thought, instead of like giving diagrams about longevity research in general, which you're probably very familiar, to focus on several examples. And the first person that comes to my mind when I'm thinking about longevity is Dr. Nir Barzilai. Nir Barzilai, by the way, graduated from the same medical school that I did. And from the very beginning, he was also in a way obsessed with longevity, how to make people live longer. And he was spending a lot of time, still spending a lot of time, on promoting a medication, which is basically a diabetic medication, metformin. And it turns out that there was a study that showed that metformin, people that took metformin actually live longer than people that don't take it. So Nir Barzilai every morning takes his own metformin, which is a great idea, except that there are several problems on this. One, and I want to share them because this is problems that all of us will face. One is when you repurpose a generic drug, you are going against the big pharma because you are taking from them a very lucrative market of cancer and heart attacks and things like this, and offer to do it with a very inexpensive generic drug. So this, of course, is a no-no to anyone that want to raise money to say, I'm going to against the big pharmaceutical companies. Right now, it's also this drug is not available because it's a prescription only and it's prescribed only for diabetic people. So Nir actually realized this, and only in these days he teamed up with a great scientist, Professor Chaim Cohen, that is a great believer in sirtuin 6. It's a protein that is supposed to make you feel better and younger and so on. And they started a company, CIRT Lab. So I wish them success. Another example, next slide, will be someone that is probably even more known. And this is David Sinclair from Harvard. By the way, Nir is from Albert Einstein Aging Institute in the Bronx in New York. So, and what David Sinclair, he also started with supplements and things like this, and even selling them. But then he came to the point that many of the other companies that work in this area are trying also. And this is to use the Yamanaka factors for producing like pluripotent stem cells that are supposed not only to stop your aging, but even to reverse your aging. And they've been shown to work very nicely on animals, on mice, on the worms, of course, and so on. And recently, David Sinclair even claims that he found a way to reverse aging of the optic nerve, which is a great news because many of the longevity companies, they have a lot of theories and a lot of promises, but until now, very little real results, real in humans, in animals you have. So this is something that is definitely worth noticing, but both Nir and David are taking one way of the longevity field. And this is, in a way, they are followers of Qin Shi Huang, the Chinese emperor. They are trying to find the silver bullet or the miraculous potion that if you drink it, you get younger, like the fountain of youth. Next slide. And then now I am coming to present a different way that some of the researchers are doing, and in my opinion is more realistic and brings more results in the near future, except that might sound less exciting or science fiction to the investors. And this is not the magic bullet. This is a hard work, which means that from middle age, or actually in any age, people should start to monitor themselves. And when I talk about monitoring, I don't mean to go to the doctor once every half a year for a checkup, which is also a good thing, but to monitor it every day, or at least very frequently. And when we monitor it, don't look only on spot measurement, like taking your blood pressure once, but try, for example, to do a recording of all night. And here you can see a recording of such night. And my magic potion is not a potion, is actually a ring. So when I wear this ring, I can follow, I can see exactly, I'll show you in a minute. When I wake up in the morning, I can see my blood pressure minute by minute, or actually second by second during the night. And cardiac output and resistance and vascular resistance and everything. And of course, oxygen saturation and so on. Why is this important? The important thing is that people, in order to live long, you need to do one thing. You need not to die. And in order not to die, you need to do something. You need to take care of yourself, like everyone is saying. But my view of taking care is actually this monitoring. And then it turns out that actually, when you're in bed, it looks like the safest place, but actually it's the most dangerous place. Because as you know, most of the heart attack and strokes and things like this happen at night or in the early morning. And this is not, and people normally don't know why, but I can tell you this secret. If you look at the blood pressure, you will see that the blood pressure is not smooth like people that are using once an hour measurement can think, but it has a lot of spikes. Some of them are actually very high, can go up to 200 millimeter mercury. And they happen to normally during REM sleep. These spikes are actually the killers, because when you have such a spike, some of the plaque, which is vulnerable, will dislodge and float with the bloodstream and stuck in your heart or in your brain, and then you have a heart attack. So I don't want to scare you, but this is something important. What is important also is that these spikes appear long before you see symptoms of like high blood pressure and so on. And so if I go back to the story of the emperor, I said, you looked at the wrong place. You didn't have to send ships all over the world. You didn't have to search for secret thing. It's right on your finger. You just need to monitor yourself. I don't know if I have another slide. Yeah. This is the slide that tells
Remind me of
you
the time
that,
limitation.
yeah. So the application, what can you do with the monitoring, things like this. So basically one of things is that you can work with people like Neil Barzilai or David Sinclair to see if their potions or whatever they do has real work, as real effect. Because one of things that people know for a long time is that every disorder or disease that happens, you can see in your cardiovascular system. The cardiovascular system is actually a very sensitive sensor to your health. So this is good for home monitoring, for, of course, people that are in assisted living. Recently, we start to see the correlation or the ability to detect neurodegenerative diseases like Alzheimer in an early stage. And you know that early stage is critical to prevent Alzheimer. And of course, telemedicine, remote care, and give you some kind of feedback. For example, people take all the time things that say, this thing is good for you, or this supplement is good for you. But you don't really know, because the fact that it's good for other people doesn't mean it's good for you. And this will give you like an immediate feedback. You start to take a supplement, you see if there is an improvement in your health, in the cardiovascular health, you know it's working. If not, you're wasting your time. An interesting story is that most of the cardiovascular disease are preventable. They are the #1 killer. About 40% of the people that die from something related to cardiovascular. If it's heart attack, a stroke, Alzheimer, and so on. And if we could prevent it, we can prolong life in almost 11 years. So instead of looking for the secret potion, just do the simple thing, take care of yourself. Hopefully with a ring or with some way of monitoring. That's it. That's my message.
If you have any questions to Dr. Barron, now is a good time to ask them. Actually, I have one, just to kick off. How to make sure that the measurement is precise? I know that measuring your blood pressure, especially with automated devices, is a challenge. In your case, how do you solve this challenge?
Okay, this is of course I expect this question because everyone is asking me, and I prepared an answer. The answer is this watch that I'm wearing. This watch is FDA approved, and it's measuring blood pressure, not estimating, but measuring blood pressure. So what happens is from time to time, I'm wearing also this watch. And this watch will, so whenever I have doubts if the measurement is correct or not, the application will automatically activate this watch. The watch will measure, and you get an FDA approved measurement of your blood pressure. This, by the way, is a critical thing because many of the people use just estimation of blood pressure. And when you see a spike or when you see, you don't know if it's real or it just was like an motion artifact or whatever. So it's very important to measure it with an FDA approved, cleared device. And this is what we are trying to do. On the other hand, we want to do it something which is seamless to the person, not to wake him at night or so. We just say from time to time, wear this watch, or I have some other watches. I have this watch. So I have plenty of watches which I wear all the time. And I know that what I'm measuring is correct.
Thank you so much. We've got 3 questions from the audience now. Can we make it brief so that we can keep time? So the gentleman over here.
Yeah, my question is when to measure and how many times in a day? When to measure?
When to make it available for the market?
From his device.
Measurements.
When to measure and
when?
Yeah.
24 hours, whenever you want. Whenever you put the ring on your finger, you have the blood pressure. I found it most valuable during night. And for 2 reasons. One is during night you are sleeping, you're not moving and so on. So it's a good time to check your cardiovascular. The other thing is that today people don't know anything about what happens during night. When you come to the doctor, he doesn't know. You yourself don't know because you're sleeping. So this is the most important time to measure. But basically you can measure all the time. You can measure it while you are running marathons or things like that.
Thank you. Thank you so much. Yes, please, your question.
Where can one buy the ring and what's the brand of the watch you spoke about? Thank you.
It's our, the company is GT Cardio and we are the one that, we don't manufacture it ourselves, but we are the one that are distributing it and selling it.
So we can Google
and it
GT
comes of
Cardio.
Sorry.
To buy it, we can Google GT Cardio, right?
Not yet, because now we are mainly focusing on selling to organizations, not to individuals. Right. But we plan to do it very soon.
Thank you. Thank you so much. Got it. Yes, and we have one more question.
And my question, if it's possible, thank you so much. I just want to clarify, I understood that you are planning to apply for FDA approval, but did you start any clinical trials or did you publish any articles like open label result randomization or any experiments? Thanks.
Actually, we have some white papers of clinical studies that we did. The way that we do the clinical studies is we put on one hand, we put like an approved ABPM device, or even this one, which is of course approved as ABPM. And in parallel, we estimate with this and we see the correlation.
And what's the difference?
Yeah. What happens is whenever there is a difference, we tend to believe more to the measurement than to the, so we are correcting. So in a way, during the time that you are wearing it, it gets better and better because it learns your blood pressure. So the accuracy goes in contrast to other things that when they get old, they get worse. This gets better and better, like wine.
I completely agree, and this is really important for hospitals, I think, to register the biomarkers to find biomarkers of kind of death, like arrhythmia, etc., to find when the person like is going to death, something like that. That's why I think it's extremely important to all of us, and that's why I wish you luck. Good luck. Thank you so much for your presentation. Thanks.
Oh, thank you. Yeah, I believe, and even some hospitals say we need to put this ring on everyone that is admitted to the hospital, because
Yeah, maybe a good
today
idea.
only critical care are monitored, and most of the people on the hospital floor are not monitored.
Thank you so much, Dr. Barron. Thank you for your presentation, and good luck with the product. It's really seems to be important and lifesaver.
Thank
Thank
you.
you. I would like to introduce David Cow, the organizer of this event and the managing partner of F50 Ventures. David, could you say a couple of words?
Okay, hello guys. This is actually our first hybrid event organized. I'm in Austin right now. Maybe actually I want to invite today's co-host ST, who is our founder world program manager. ST, maybe you want to welcome everybody.
Hey everyone, thank you all for coming to this to our first ever hybrid event. And yeah, so as you may know, if you remember, I was used to host some of these startup founder world event demo events here at Procopio. Now I'm currently in Virginia Beach area, so I am basically on the other side of the Bay Area in general, and I'm glad that we finally got this opportunity where we can combine both the in-person and the online events into one and be able to bring people together. So I just want to thank you all for coming. And yeah, so David, over to you.
Yeah, thank you.
Go ahead.
Oh, you said David. I thought you said German.
Sorry. You want to say something, David?
Okay, so just talk a bit about aging and longevity. So I had spent lots of time in the area last few years. I invest in one of the we call the diabetic companies. We take lots of effort by evaluating different paths to longevity. We found out one of the paths is actually the chronic disease, which any cure of the chronic disease will indirectly lead to a longer lifespan. Anyway, today is our actually the second time we do the startup showcase on the aging and longevity in the sector. So actually, I want to introduce another speaker / judge today. Maybe Ravi, can you introduce yourself? Where's Pavan? Hey, Ravi, Pavan.
Ravi, can you hear us?
Okay, maybe he's stepped away. He was there right now. So maybe I want to introduce Siva. Siva, can you introduce yourself?
Sure. Where should I look? I just it
Yeah.
doesn't. Cameras.
Yeah.
Just the camera. I can see you, Siva.
Okay, perfect. Thank you. It looks like I'm the only judge,
On-site judge, yes.
in person. I'm actually from
The real embodied judge.
Yes.
Be a judge.
And thank you for having me here. Thank you, David. I have a long affiliation with F50 from the times when David was here in the Bay Area, and then he moved to Austin. I had the pleasure of visiting Austin and his ranch was a couple of years ago. Did an amazing event, startup event. I am by education a mathematician, turned into biotech, spent a number of years as a university professor, and then got trapped into the spiral of startups. Did a few of them, successful exit, and now I'm on my fourth one and I'm enjoying it.
Thank you so much for that.
All right, cool. Yeah, let me quickly introduce Ravi as one of our speakers / judges. So Ravi, you want to quickly give a few words?
Yes, hello. Yeah, I started a company called Verge Technologies So we eliminate database outages and provide agnostic database mobility across all cloud service providers. So we're the first in hybrid cloud, cloud convergence, and multi-cloud. So the idea of what I wanted to do was to be able to, we're working with the government, a couple of projects on the government side, and we're working with a couple of major corporations as a white label solution. So we're going to get started by end of June. But I really, just to give my background, I've got around 30 years of healthcare experience. I created the first expert system in 99. We gathered 3,000 to 4,000 individual variables of the human being based on library results found in medical history. We codified 38,000 New England Journal of Medicines into norms. It's just unfortunate. We had an offer for the company in 2000 for 100 million. And I raised all the money for the company, and the CEO and CFO said it was worth $1 billion. And we went down with the .com. So yeah, so I always thought it was luck, timing, and marketing to be aligned to be a successful company, but I realized it's also the people. You gotta have the same people that share the same ethics and values that you do. So the idea was, when I created Verge Technologies, I created this company. The idea was to do two sides. One was, once we reach 100 million a month in revenue, I want to put 10% of the profit to help global collaborative nonprofits, benefit corporations, impact corporations. I met David about a year ago through Pavan, and since he moved here to Austin, I've been in Austin for 24 years. Also, and that's another thing also, we were the first healthcare company in Austin. So we raised all the money through California, Boston, and global, but maybe around 10,000 was from Austin. And there was only one venture capital in healthcare at that time. And so it was kind of difficult to get things moving forward, what we need to do. We actually were working with Dell, with Michael Dell, and the Seton Hospital, Ascension Health, they saw us as a clinical piece for what we need to do, but unfortunately Dell got involved with it, and it just shriveled off regarding to it. So that's why I'm very interested in working with David. David and I share commonalities of what we want to do. Is we wanted to set up between San Antonio and Austin a longevity, wellness, and aging center. I still have some of the IP. I try to sell the IP to Watson Group, and to this day, IBM Watson Group and stuff. So to this day, what we developed in 99, 2000, we're still ahead of the curve. It's just unfortunate, but I started a stem cell company about 2 years ago called Cell Regeneration International with one of the CEOs who I tutored, the son who had Asperger's. And I wanted to be able to eradicate autism, Parkinson's, MS, Alzheimer's, dementia. State of Texas, I don't know if any of you know this, state of Texas is the only state that approved harvesting stem cell because of the Dell Medical School. The student I tutored, the CEO's son I tutored, he had stem cells in Panama and Monterey, so it really works. The Russians are 50 years ahead of us in stem cell science. The Europeans are 20 years ahead of us. I still want to get that going next year, after I sell the company for Verge Technologies by the end of the year. That's all I have to add. I can always talk with anybody who has more questions, but I learned a lot. And unfortunately, with failures and stuff, you learn a lot in terms of what you need to do and know who the people are. So I'm looking to work with like-minded consortium of people to eradicate diseases. And it's not going to be with AMA and pharmaceutical companies, because it's all about greed and profit. So I'm looking for people who are like-minded to join our consortium. Thank you.
Thank you so much, Ravi. Thank you. So let me introduce today's speakers. So we've got 5 startups presenting today, 5 founders. Thank you so much for coming here. They're all in person, flesh and blood. Daniel Rechin is the CEO and founder of MedBladder. Let me just name all the founders first so that we know who is here today. Eva Gelland, founder and CEO of Hashiona. Thank you for coming. Michael Zastrojan, the CEO of X Cryo Storage on the Moon. We've got Kiichiro Yoshida.
Oh,
thank you so much.
That's my business partner, so
yeah,
I'm going to present.
Yeah. The company will be represented anyway, Seno Health. And we've got Benedetta Di Robiland, the founder and CEO of Durant. Thank you. So Daniel, would you like to kick it off?
Certainly.
Let me pull up your presentation. This is how it will work. We will have 6 minutes for presentation itself. You've got a timer running here.
Yes,
and it will be in an estimate manner when the time is up.
Yeah.
Okay, so we'll have to cut it off from there. And then we'll have 4 minutes for questions and answers, and the judges will have priority in asking questions. Okay?
And
okay, here is your deck. You can just push space or right or left. Okay. And I will operate the timer. You got it?
Great. Thank you so much. Thank you, everybody. Mad Bladder. I hope that name is as appealing to you as it was to me when I first heard it from my co-founder. I love the name. And of course, it connotes something about the bladder. And you may be wondering, what is this? How would we choose such a crazy name? Well, what we provide is a system for monitoring the incontinence state of people, mainly seniors. That's the main market. Great. We have a team of 4 founders. Those are the 4 of us that are on the left side of this page. We're pretty well balanced. We've got 2 folks who are technical, 2 who are business and financially oriented. So we have a really nice balanced mix of folks. And then the 2 folks on the right are our advisors, and they are out of the University of Arizona in Tucson. And they are the ones who, through a conversation which I was involved in, which co-founder Robert was involved in, they were the ones that when we brought up as some history, our having worked with an incontinence system, they got excited and they said, that's the stuff we're interested in. So we decided to found the company based on this. So there's a real need for this, and I don't think it's necessary to go into the details because probably many of you folks have some direct experience with perhaps a senior loved one who may have needed advanced care and was incontinent. It's a very common situation, and I won't dwell on the fact that it is a very common situation. Our incontinence monitoring system is essentially, it's an IoT kind of a framework device. It's the usual kind of thing, wearable. There's disposable part, which is the part that senses the incontinence. There's a non-disposable device, a controller, and then it's a Bluetooth device, and then it communicates with the base station up to the cloud, to servers, and then back down to alert caregivers, either at workstation or mobile devices. And this is worn essentially in a diaper. So one of our major competitive advantages is that not only do we detect urine, but we're also selectively detecting feces. And that's extremely important. Urinary incontinence, if you don't get to it in time, it's not necessarily an overwhelming problem, although it's something that cannot keep going, obviously. But with fecal incontinence, that is something that needs to be taken care of immediately. And there's not a lot of our competitors that appear to offer it. Huge market opportunity. Total addressable market is about 5.5 billion. Includes home care, which is the majority of it, which is about 5 times the institutional care. However, it's the institutional care that's a lot more addressable, and so that's what we're focusing on in the next couple of years. So we have some great advantages in terms of our IP. We've applied for a non-provisional patent about 6 months ago, so it's probably going to be published pretty soon. we have a very strong team. Business model, it's essentially subscription-based. And we're looking, I believe, for about $75 to $90 per month per user. And again, we're mainly addressing long-term care facilities. We've got a few partners, a few folks who are quite interested in us, and they have provided letters of support for our National Science Foundation grant. One of them is from Medline Industries, and we've actually been talking to them, of vice president in particular, quite a bit. And they've been providing us, or she's been providing us, quite a bit of input in terms of basically the perspective that they're looking for in products, because they are interested in going into this space. And they're also giving us some advice on things like reimbursement, and even hooking us up with some folks with some expertise in that. So we're pretty happy to have some of these folks. So what are we asking for? $2.1 million in seed money, and this will essentially give us the ability to get regulatory clearance, 510K, also come up with the MVP. And we will be able to conduct IRB or pilot studies essentially as well. So that's what it's all about. It's providing the best possible care for the elderly with respect to incontinence by providing an accurate alert system that's affordable.
You still have 7 seconds.
Well, ask a question.
Yeah, 4 questions. We'll have 4 minutes timer. Let me stop sharing. So, questions to Dan, please. So Dan?
Can you double click? I mean, first of all, congratulations, because you have been founded the company less than a year ago, if I read correctly in the first slide. So
it's about a year ago.
Yeah, tremendous progress. Can you double click a little bit on the actual product itself? Where are you? Are you building the MVP? Do you have the MVP? And what you showed us, is it something that is potentially reusable, the IoT sensor, or not?
Right. So there is a disposable part. Okay, and it's a matter of sanitation and whatnot. So our goal with that is not only to be able to do all the various tricks that it's supposed to perform, but also make it very inexpensive. The controller that it attaches to is wearable as well, and that is not disposable.
And can it be reused too?
The controllers, yeah, is reusable, but not the part that's going to be wet and that's going to detect the incontinence.
Thank you.
Thank you. Do we have questions from online judges?
I don't have questions.
Oh, this is a camera. Oh boy. Okay. Okay.
David?
Thank you. I don't have question.
Any questions from the audience? Yeah, we got plenty.
Okay.
Yes, you were the first.
Yeah, so for your device, is it rechargeable?
No, it's not.
Okay.
But it's very low power.
Okay, and then, but
I mean, it may become rechargeable, but we're not too sure, but yeah. The primary focus that we have is really on the disposable, and that's where like 95% of the technical challenge is, at least as far as the wearer is concerned.
Yes. Because you still have to have the power to send a message to your cloud.
Correct, but it's common for Bluetooth devices these days to be able to run with advertisement signals for a year or two, just on a little coin cell even.
Okay.
And we don't need to restrict ourselves to a little coin cell.
Thank you. Thank you.
I know in the startup we need to be very focused and get this part done before thinking about the next one. But one of the things I was thinking is that urine is a fluid that you can test for a lot of diseases.
Right.
And my question is there a second plan on being able to measure proteinuria, measure blood, or measure other things that usually are increased, especially in the elderly?
You could imagine submitting an NSF, National Science Foundation proposal, and I'll let you take your guess as to what we might have put it in. But one of the things that we do, even right now with the baseline product, is we're actually able to measure the salinity of the urine. Yeah.
What's the difference between the IoT device for baby and the elder?
The difference for
baby. Little baby and for senior or disabled people.
Oh, okay, yeah. So there are the ones for babies on the market. Those are generally reusable, and they're, I think, a lot more clunky, perhaps. So these things are really designed. Ours is designed to be, and we'll go through wear tests to prove this, but it's designed so as to not cause any discomfort or anything like that. Some of these seniors are more likely to play around and pull it away and things like that than even little kids, I suppose.
Thank you so much. Well, just make it short, yes.
You want me to add up to the...
Oh, yeah, please do.
Thinking for the baby one, there's a difference between a consumer grade product versus a clinical grade product. What we're building here is a clinical grade. So accuracy is somewhere between, how to be like 98%, 99%. But for the baby market, you can kind of get away with like consumer grade product, maybe 75%, 85%, probably like, those watch or ring, So that's a big difference here.
Thank you so much.
Yeah.
Thank you.
Thank you.
Eva, you are the next with Shimona. Yeah, left and right.
I'm looking there, right?
It's over there, yeah, your camera.
Perfect. Hey everyone. Before we start, I would like to ask you for one thing. Please remind yourself the worst hangover you ever had. Do you remember the feeling? The tiredness, the muscle pain, the confusion, and so on. Because if you do, then you exactly know what's the reality for 480 million women globally, every single day. Obviously, they don't have the fun part. It is because 1 out of 8 women has or will have thyroid disorder, and that's the data according to American Thyroid Association. Those women like me may have up to 45 different symptoms, and that include permanent tiredness, sleeping problems, getting weight, depression, and a brain fog, and many others. My name is Eva Gallant, and I'm founder and CEO of Hashimoto. In Hashimoto, we help patients with autoimmune disorder, specifically with Hashimoto and hypothyroidism, to get into clinical remission and improve the quality of life in a non-pharmacological way. The current treatment for those patients is very easy. It's one simple generic pill called levothyroxine that they're taking before the breakfast. However, by the way, levothyroxine is the second most prescribed drug by GP in the US, top 5 in Europe as well. However, over 70% of the patients being on a levothyroxine still feel either some of all of the symptoms, which make their quality of life pretty poor. That's why we came up with Hashimoto, because levothyroxine have to be complemented with permanent lifestyle changes, similar to the diabetes, where we complement insulin with diet and sport activity. For Hashimoto, it's the same, but it's a little bit more complicated. It includes more restricted diet, only some of the sport activities, stress release, overall health, sleeping patterns, and many, many more. So what I want you to actually remember from this is that general health advice for autoimmune patients are not always the same for the healthy people. So how does the solution works? Right now, when people just join Hashiona, they sign up on the platform. We send them home-based blood tests to first mark the current health condition. Then we ask them to fill in some specific surveys. And after that, our algorithm is preparing for them 6-month recovery plan. That includes diet and supplement plan and access to our step-by-step remission program. The program that we designed by analyzing 1,200 medical papers. In the week 6 and week 12, we ask the users to retest again, so we can basically track tangible effects of the therapy. After that, there's a maintenance period which takes 3 to 6 months. So in the summary, what the user get? They get diet and supplement plan, they get step-by-step remission program, monitoring, insight and analytics of both symptoms and triggers. They can get personalized recommendation, they can talk to our clinical dietitian via text chat, they can connect their wearables, and shortly the blood testing, which we're actually testing as a first market in the UK, and we're rolling it in a week from now. So super excited about it. In our team, we have more than 46 years of combined experience from product, marketing, and technology. We have been also validated by the best world-class accelerators across 4 countries. And on top of it, we have full clinical, technology, and operational team, including 4 professors and professor of medicine, professor of clinical dietitian, behavior change expert, and so on. It's not on the slide as well, but we also have a local advisory board, which include Dr. Walter Greenleaf, who is a professor at Stanford, and also neuroscientist, and also Ben Alof, who is also medical, I said also a lot, who is also chief medical officer and Limbix, another digital therapeutic solution. We also did clinical validation twice in terms of the preclinical studies for a small group of people, 25. We get fantastic result, improving the quality of life over 78% for those people, which encourage us to do the proper randomized trials, which we're actually finishing right now as we speak. We supervise 100 patients divided to 2 group, intervention and control group, and the result will be on the end of this month. Business model here is super simple. Right now, we are operating as a wellness platform. However, the ultimate goal here is to be a full digital therapeutic solution. So after the patient trials will be finished, we're going to seek for FDA approval, 510K as a medical device, and next we will go to the payers. So far, we raised more than $720,000, and right now, we're looking for a seed round of the size of 1.5 million to focus on certification as a medical device, adding 1 or 2 medical other autoimmune disorders. We think here specifically about insulin resistance and PCOS, because we see a lot of correlation between those 3. Our machine algorithmics to do the personalization on the deeper level, and the white label blood test that we're testing right now. Thank you so much. I'm happy to answer any question you may have.
Today you have a question, or shall we pass it to online?
I have a question. So quite impressed with your presentation structure. I'm wondering how many of team members are full-time or primary jobs functions focused on your startup?
Right now we have 14 people employed.
How many full-time?
How many full-time? Yeah, the 14 people are full-time, basically.
Okay.
We have them in Poland, so the costs are a little bit smaller than here, I would say. But in the future, obviously, we will have to build in-house sales and marketing team here in the US.
Where are the 14 people located right now?
In Poland.
Okay, got it. So how long have you been in Silicon Valley?
2.5 months, actually. So I'm pretty fresh, very happy to be here.
Okay, cool. So when you say FDA approved, I talk about which, I talk about US's FDA, or talk about other places FDA?
Yes, that's correct.
Okay. Okay, cool. So you raised the $740 million. Who are the investors? Who are your current investors?
Yeah, so we have right now a couple of funds from Europe, 2 from Poland, 1 from Czech Republic at Kaya, 1 from Austria called Kornstorm, specifically for HealthTech, and here locally we've been in portfolio of Draper University.
Okay, cool, thank you.
Perfect, thank you so much.
Any more questions from the online?
Are you pre-revenue or do you have some traction?
Yeah, so that's a very good question. Thank you for that, for this, Raja. So basically, for the last 2.5 years, when we developed the product, we were trying different kind of business model, and we put over 30,000 beta testers through this platform. And then last year, we did a kind of pivoting, change a little bit of communication, add a little bit of couple of features, and we run periodically sales tests to see if people will be able to use it, buy it out of pocket. And so far, we got like 400 paid subscribers over 3 months of the testing. So the users are still with us; they're paying, but we do not run any active marketing campaign because we're focusing on the patient trials and the certification to go ultimately to the payers.
So when you do your next raise, that 1.5 million, where do you think will that obviously you'll start getting some traction? There'll be some marketing dollars there.
Yeah.
What do you anticipate? What do you project for your ARR or MRR?
Very good question. So in fact, out of the 1.5 million, we're planning to spend 45% of this for the marketing and customer acquisition, specifically here in the US. And we estimate that for this, we will generate around 800K of ARR for the period of like 15 months, even before we go to the payers.
Do you have KPIs now based on the tests that you've done?
Yes, we do. In fact, I don't have the presentation here.
Yeah,
but I have.
well,
yeah. Perfect.
Like
Yeah, because there's some
but
other hidden
shared.
slide. But it's not shared. Okay. So yeah, basically we measure the KPIs, we measure the adaptation, stickiness, basically everything, which that's not my job.
Oh, sorry.
That's my pleasure.
I like that
no
presentation
worries.
a lot.
So we definitely measure it. In fact, according to the benchmark for digital therapeutics, we are pretty good in terms of the retention, which is usually like the biggest problem for most of digital therapeutic companies.
I can't really see from you. Do you have a churn up there?
Yeah, so the churn after 3 months is 41%, after 6 months, 28%. Once the benchmark on the market is usually around 70, even more percentage.
Great.
And we still have plenty of ideas how to improve that actually. So we hope to minimize that in the future. Okay.
Thank you so much, Eva.
Excellent.
Yeah.
Thank you. Round of applause. When Eva was answering the questions, did you see Eva on the screen, or because I think Zoom shows the audience? David, Esti, did you see Eva when she answered the questions?
No.
I didn't see anything.
Okay. I don't know. There is an automatic sensor, I guess, that it shows me on the screen right now. But when Eva was answering the question,
It's on speaker view, so whoever's speaking,
yeah,
that'll come up on that screen.
Okay, maybe the microphone. Okay, no problem. To the speaker, just speak louder, I guess, when you are here, so that the computer knows where you are. So the next speaker is Michael Zastrojan, Axe Cryo Storage on the Moon. I'm really interested to know what that's about. Let me pull up your presentation here.
Yeah, seems like that. Hello, everyone. Yeah. So first of all, to speak about this project, I think that we have to start to think about anything. Yeah. Of course, generally speaking, if a cure for aging or well-known neural interfaces are invented, this startup probably will be not needed. But if, let's say, these neural interfaces, of course, they will not be invented, and the cure for aging, unfortunately, will not be invented during our life. So we will dead, yeah, we will dead. But what we can do to solve that problem? Of course, cryonics can help us to solve such problem and to bring our body to the moment then these technologies will be developed. But existing companies like Alcor, like Cryonics Institute, etc., they have a lot of risks, as I see, like bankruptcy, different technical problems like supplying of nitrogen. And I know a lot of stories. I don't have enough time now to explain everything, but trust me, a lot of stories then supplying of nitrogen, it's stopped, and their bodies, like, unfortunately, is going to unfreezing and people dead. So we decided to transform these markets radically and transport these bodies to the moon, to the lunar craters. Of course, it can be really sounds like madness, but trust me, again, we can explain everything. And so what we're planning to do, we are planning to freeze these bodies here in, of course, currently already existing infrastructure like in Alcor companies. And again, for example, I have already found in Berkeley TransTime company, which is also can work with us. Yesterday, I spoke with them. And so we are planning to collect these bodies here. And after that, after 5-10 years, a bunch of people we can transport to the lunar craters using rockets. Of course, currently it's Falcon Heavy, but in the future, of course, after 2025, we really believe that Starship will be developed and we can use that technology. So the rocket will be launched from here with dewars, with nitrogen. It would be like something new, not simple liquid nitrogen. And these bodies will be going to the moon. And the second rocket will be going from this rocket into the lunar crater, where it's not like, again, it's not simple places on the moon. It's specific places on the North Pole of the moon, where NASA previously found the darkest places without any X-rays and other rays. I mean, the level of radiation is the lowest. And so these rockets will go into the moon. And after that, these bodies can be stored there in for thousands and for millions of years. And people can wait there, these technologies, for hundreds of thousands, many years from the current civilizations, probably after, if World War III, probably in the future, start after the, probably from the next civilization or probably from outside civilization, but for millions of years, it will be safe there. So about markets, of course, we calculated that term. It's the number of millionaires who have more than 10 millions in the bank. So according to different surveys, about 13% of people are ready to pay for their cryonics technologies. They want to be freezed. And we are planning to reach about 5% of such markets. It would be about 13 billions. So launching of Falcon Heavy currently is about $90 million, but we are expecting to get the revenue about 1 billion. So it would be much bigger. So we are planning to be the profitable company. And comparing to other cryonics companies, we will be much more profitable. So thank you so much. I have 30 seconds. I just want to say that I'm not mad guy. I just have been working. I completed 2 PhD in medicine. I've been working as a postdoc of UCSF. So I have 28 Hirsch's index and a lot of citations, like more than 16K now, and it's growing every year. Thanks.
I wouldn't tell that you are crazy.
I hope so.
I guess this is what you call a moonshot?
It's literally a moonshot.
I know it sounds crazy, but we have the QA file now for all the steps for 50 pages for many of the most common questions. This is 16 days. This is 16 days project. I started it's in May, the 2nd May, and I already found the team. I just didn't provide them from Stanford, from UCSF, one more guy, me. I found advisors two from NASA, one guy, CEO of a company who is transporting something on the orbital, and 3 guys from YC, CEO of companies from biotech, from space tech, and Y from CBO of one AgTEch. So that's why we have the full team, I think. Yeah. We make a lot of pivot during these 16 days. That's why probably it's changing every day. That's why I just decided to skip the slide. Sorry.
Okay, cool. So I have a question. Very interesting idea. So we saw several startups doing freezing the body who are, we call the dying people, means they have a fatal disease, and freeze them before they die, and store in the earth, and maybe unfreeze them like 10 years or 20 years later if the technology is enough to cure their disease, like they have a heart disease today, I'm dying, and we unfreeze them. Before I die, okay. So then unfrozen 10, 15, 20 years ago is technology available. So this is the well-known concept. I'm wondering, what is the benefit compared with those frozen on Earth instead of in the moon? Maybe let me give you another alternative. Elon Musk is working on solutions to massive transport people from Earth to Mars. Why not freeze them on the Mars instead of on the moon, which is right now does not have a transportation, third-party transportation services? I'm kidding.
Excellent question. If they're talking about the already existing cryonics companies, we have many advantages, which I already told you, because we don't need to supply nitrogen on the moon, because where will be the stable temperature minus 240 degrees Celsius, and it wouldn't be the right temperature. It can stop all the biological processes for millions of years.
I have a question. Why do you want to start alone? Because let's say I have $10 million, I can freeze myself with the body. If somebody has 10 million, they can freeze them on the Earth, I don't know, 20, 50 years. I think, to my knowledge, 20 years, 50 years probably is long enough for them to find out the technology which can recover them.
Let's trust. I'm not sure that these 3 technologies, the crucial technology, will be developed. The first one is careful unfreezing, defrosting. I think that this technology will be developed after 50, 100 years. The second technology is more difficult to develop. It's how to treat the consequences of these of like strokes and heart attacks. I mean, how to repair this field of area of necrosis, and probably in the future it would be like nanorobotics which can do it. But currently, I'm not sure that during even 100 years it will be developed. And the third one is a cure for aging. I think that, of course, a lot of guys working in it, like in Silica, Alex Jarnikov, etc., but and they believe that they can do it during 10 or 15 years. But I think, and if it's if it's invented, I'll be extremely happy, and I will be the first guy who buy it. But if not, I'm not sure that it will be developed during 100 years, 200 years. That's why I want to freeze my body on the moon.
That's why I don't agree with you, but let's move on to the next question. Why not to Mars instead of Moon?
Because on the moon, on the Mars, if the problem on the Mars that radiation, and now NASA and also SpaceX are trying to solve this problem, because to transport people during 2 years or 3 years, they will be extremely damaged by the radiation, and now we are not able to protect them, even bodies. On the moon, it's just only 4 days to travel there, and there are places without radiation, with the ideal conditions to store such people. It's less expensive. That's why I think that this is ideal place to do it. Yeah.
Okay, so once you have transported them to the moon, is there any recurring cost? Or you just leave it there? I mean, and there is the recurring cost would be zero.
If we after transporting these people to the moon,
after the transportation.
Yes, we will not have any costs after that. Yeah. Now we have to complete our R&D processes to develop different parts of the. I don't have enough time to explain everything, but if you are interested, I can explain what we are rising currently on the 16th day. We even found the first angel, to be honest. This cap, I can explain everything. Yeah.
My question is more simple. Why not choose southern pole, north pole? And when you frozen the body and heat up, probably some disease come. Have you tried this kind of therapy or treatment?
You mean North Pole and South Pole on the Earth?
I'm sorry, we're running out of time. So can we move this question for background discussion?
Okay, thank you so much.
Thank you so much. I've got thousands of questions actually to Mike. So the next speaker is Benedetta with Dorian Therapeutics. Let me make sure that we've got the right deck here. It shows the last. Just a second. I'm working on that.
Okay. Thank you, everybody, for having me here and giving me the opportunity to talk about what we're doing at Dorian Therapeutics. We don't go to the moon. It's not as exciting, so I'm sorry. After this talk, it's going to be difficult. But again, the mission of Dorian Therapeutics is to improve health span by developing a new class of therapeutics that we call xenoblockers that tackle the molecular cause of aging. And of course, the first question is, what is aging? And again, it's a very complex phenomenon. But what we think is that at the tissue and the cellular level, there are two main events that happens, which is an increase of senescence of the cells and a decrease of the stem cell activity in the cells. So what normally people have done, traditional approaches have tackled one problem at a time. So senolytics that kill senescent cells or giving stem cells to the body in order to improve the stem cell activity. But what we really think is that in order to really tackle aging, we need to target both the processes together. And this is what we are trying to do with our xenoblocker technology. Of course, is this even possible? And of course, the answer would be yes. And we came to this hypothesis that we need to target these two together because we found the first target, the first xenoblocker target during our work of me and my co-founder at Stanford University, where we found in 2013 USP16, which is an epigenetic regulator that is responsible for the accelerated aging that we see in Down syndrome patients. This happened in 2013. From there to today, there have been at least 9 different mouse models of chronic disease that have shown the role of USP16 in these diseases. And then in 2018, we founded Dorian Therapeutics with the aim of actually developing small molecule to target USP16. And we're now ready for IND-enabling study to target age-related diseases. And of course, nothing of this would happen without the support of our investors that have been helping us all the way to here. Again, we talked about Down syndrome, and Down syndrome is the perfect example of accelerated aging. We've been working on Down syndrome for a lot of years, and we know that the clinical feature, there is skin aging, osteoporosis, Alzheimer's disease, and what we found is that actually there is an increase in senescence in the tissue coming from Down syndrome patients and a reduce of the stem cell activity. And all of these ends up having an accelerated aging, and this has been calculated by an epigenetic clock, which is a biological clock, that shows that actually Down syndrome patients have about 15 years older compared to the chronological age. And what we found at Stanford is, again, this epigenetic regulator, USP16, as a key culprit of the accelerated aging. We not only found that it's important, but we actually found that if we target it, we revert the senescence and also the stem cell go back to normal. And this is critical, not only as a tissue level, but also as an organism. We saw it in Alzheimer's disease, we saw in metabolic syndrome, and in osteoporosis that we had an amelioration of actually the disease. So what does USP16 do? It works on the chromatin. So the chromatin is how our DNA is constructed in our cells. So when there is low USP16, we're healthy, we're young, the chromatin is very compacted, so we cannot actually access to the DNA. What happened during aging and what happened during disease is that the chromatin unfolds and you start producing protein and transcribing DNA, transcribing piece of the DNA that actually accelerate aging and reduce stem cell activity, increase inflammation, and increase senescence. So we decided to target USP16, and we spent a lot of time. We finally found a drug that is very good in inhibiting the activity of this one specific enzyme. And we have 2 different ways in which we will will administer these to patients. One is through oral administration, and the other one is through local injection for osteoarthritis. And again, being an aging company has the advantage and the disadvantage and the challenge of finding what is the best indication to actually move this program forward and to go to FDA. What we've been working in to have a pipeline in a pill. So we're going to develop one drug that potentially can be used throughout different diseases. Maybe we might need to change something on the small molecule depending on the thank you.
Thank you so much. Please stay here. Any questions from the judges in the room or online?
Well, I guess, thank you very much. It's lovely to hear a presentation from a chief scientific officer because you get to see the technology. Tell us a little bit about, you're going for clinical trials. How big is the team? When was the company started, by the way?
The company started in 2000. Can I share?
Would like me to share
the again?
deck?
Yeah. Here. Thank you. So we founded the company in 2018. Madeleine and I are the 2 founders. We both worked at Stanford for a long time, where we work on this molecule USP16 for over 10 years. We have a fantastic VP of chemistry that comes from Amgen. He has more than 13 years experience in bringing a molecule to the clinic. And we have a finance and business guy that joined us part-time to help us developing the product. Also because we have different, I just show one part of what we are doing. The team is, we have 7 full-time employees. And we, again, raised some from we won 2 grants from the NIH, and then we had private funding, and now we're starting our Series A. With the Series A, we would like to go in a clinical trial, start first in human, or at least FDA approval for osteoarthritis. And then we have a second indication, which is would be an oral indication, where we are a little bit behind, about 6 months behind. And so we would like with the Series A to reach to starting the IND-enabling study for the second indication. And then we also have some other, one other asset, what we call it's a different small molecule that we use during the production of CAR T cells or immunotherapies, because when we take cells and we put them in vitro and expand them, they actually age very fast. We calculated that CAR T age about 30 years in 2 weeks. And so we found a small molecule, another asset where we can actually add to the during the manufacturing and maintain them young. Thank you.
Questions from online judges?
Cool. Quite impressed. You speak very, very fast.
Sorry. 6 minutes.
Okay. So you mentioned you received some grant. Can you share us a little bit about your funding, including grants and funding?
So we raised about $7 million from 2018. To plus these two grants. One grant was about $4.3 million and the other one about $300K. One from the NIA, that is an Institute for Aging, and the other one from the NCI, which is the one for cancer.
So what is your goal? So, startup founder world is a pretty small, earlier stage community. So what is your goal? What do you want to achieve when you come to, first, very impressed. Okay, so I want to know, what is your goal you want to achieve?
By being here or by?
Yes.
Oh, definitely getting to know more people involved in the aging and in the longevity field. This is the main, the main thing is to, first of all, we are starting our Series A. So definitely this is one of the reasons why also I wanted to show you what we're doing and share with you what we do, the challenges in working in the longevity field, which is multiple people are facing, and also getting to know the people that are working in the longevity, both in the therapeutic side, but also in other fields. And again, we're open for investment. So also this is a part of why we want to showcase also Dorian Therapeutics.
Cool. Have you spoken with any like Silicon Valley venture capitalist yet?
Yes. Yes, we started the process, I would say a couple of months ago.
Okay. So can you tell us a little bit about your financial needs? So how much money are you raising and what is do you expect to, hope to achieve with the raising?
I didn't send you the hidden slide. Okay. I deleted it. So basically, of course, we need to develop a new small molecule. We need to modify the small molecule that we have in order to have it orally. And this is a long process, a chemically long process that requires at least 6 to 9 months from now. And for the other indication, we would like to do a first in human clinical trials. So depending on how the conversation goes, we're looking to raise between 10 and 20, depending on what milestone we want to achieve. If we want to take 2 of our indication further, or if we want to start with only osteoarthritis, this of course will be less. But we would like to be able to do a first in human clinical trial.
Okay, so I have a set of questions, not related to pitching. So I'm quite impressed with your pitch. Seems you're not native English speaker, just like myself. So how long have you been in States?
Despite my accent, that will always be with me. I think that I'm not going to get rid of it. I've been in the States since 2012, back and forth. And between Stanford, I did part of my PhD here and part of Stanford. And from 2015, I started my postdoc at Stanford. And then in 2018, we started Dorian Therapeutics with another collaborator of mine that was working at Stanford University with me.
Okay, great. Thanks a lot for presenting. Good luck with your venture funding.
Thanks.
Let me do some experiment. Again, I can see that Zoom shows the room, right? David, you can see the room, not me. Okay, now it's me.
Yeah, you have to.
But it was manually spotlighted. Okay, Zoom has way to go in telecommunications. Yeah. So we've got the last presenter for today. Sano Health will be presented by Wira. Just a sec. Let me pull your presentation. Hi everyone. Thank you. My name is Wira Sudarmono. I'm with the Clear Lake Holding. So today I'll tell you a little bit story about how we come out with this company. It started years before the pandemic, where my kids still young, and they get sick easily because there's not a lot of good sanitizations and so on. So we used to live in a life where we are so carefree. We don't have any afraid of any pandemics or even a lockdown or quarantines. We do have even though we have like influenza sometimes, but that it doesn't require us to be quarantined. So through this pandemic, my business partner, the three of us, you will see it later on. We see an opportunities to develop new innovations in terms of personal health. Personal health covers a lot of different topics, from skincare to diagnostics to treatment or therapeutics. But today, I'm going to talk a little bit about the topical preventions. So we live in a world that populations keep on growing, getting more people, and we live in a world that disasters happens. Natural disasters are man-made, which is wars in Ukraine, or even fires in Manchester and everyone else. So during this time, they don't have water. They don't have enough sanitizations in terms of using clean water to wash the hand, or even do anything like to make sure the hands are clean before any surgery or any wound care and so on. As you can see, half of the close to half of the populations during the pandemic got COVID. And what we're trying to do is we're trying to develop better sanitizations. So preventions, it's a key to us, as we are, the preventions that we used during the pandemic. It's been used since early 1900, which is hand sanitizers, wash your hand, and get a mask. Nothing new. So what we do is we develop a new product that can persist on your hand. A hand cream. Imagine you have a hand cream from L'Occitane, the high-end hand cream, but that is also sanitize your hand. It's good for the doctors. It doesn't contain alcohol. And the keyword is persist longer than 8 hours, just with one use. So what we value is our safety. What we do in our company is make sure the product is safety for any ages, for the babies, effectives, which is like we can sanitize any kind, a lot of the bacteria, and also in high quality where it won't dry your hands, it won't damage your skins. And especially for, we also work with the senior living, where the process so strict in terms of cleaning the hands. So the first year that we are going to do, we are going to focus on the topical cream, which is the topical delivery, and mucosal, which is oral, where we do carry a patents on the topical. We have a product that I brought a sample.
I'll share with everyone later on. And actually, our product is being used in Ukraine by the military department because we sent it there. We thought that it's going to help people to sanitize their hand during the war. There's no enough water. What we did, we sent it to Ukraine, and then the military used it for their feet, just to prevent fungal infections. So we have a letter from Ukraine military department, the medical side of it, to send them more so that they can prevent a lot of the infections, especially during the surgeries, or even like infections for fungal for the feet. So the first few years, we're going to focus on the topical side of it. And we do have a patent pending for the product that we call it Isengard. And then we're going to work on a mucosal, which is a orally dissolvable film where you can put supplements or even medicines down the line, and then it will deliver to our body without going through the digestive system. So it will have more efficacy. So this is our team right now. I didn't prepare a lot of presentations after 6 minutes. It's really quick. So, and what we're looking for right now, what we're looking for is an investments and a partnerships in terms of distributions. Thank you. I'm just trying to keep it short and simple.
Questions from judges? Online judges?
I guess, can you talk about your competition a little bit? I'm not clear what.
Yes.
What's your differentiator?
Yes. So our product, it's in a cream format. It's non-alcohol, and it persists longer than 8 hours. We did testings. It kills a lot of different bacteria, even including Pseudomonas, or the one that is MERS and Versa, which is it's very critical in hospitals, especially during surgery and so on. So, and also our product is also safe. We tested on children that it doesn't give rashes, because a lot of the sanitizers out there, they give you rashes, and then alcohol only protect us for two minutes the most. Once you evaporate, there's no protections after you touch everything. That's why the idea started a long time ago when I have my kids still young, and then they all go to playground, and then have to grab anything they want to eat and then just put it in their mouth, and they got sick. So that's what the idea is coming from, and then the pandemic accelerated this.
Is this OTC?
Yes, this OTC is registered.
And in secret sauce, one clear leg. So I should buy more than that. No, I'm just
Yes, you should.
Really?
I'm just kidding.
Any more questions from our online team?
Yeah, I have one question.
Yeah, we have.
Oh, yes.
You mentioned it was possibly a medicine delivery vehicle. Can you infuse any medicine of choice in that type of product?
Yes, for the oral dissolvable film, yes, that we will, but we will have to go through FDA on that kind of stuff, depending on what kind of drugs. If it is approved already, like Advil, right, we can just input it in there, and then possibly we can use lower dosage.
Actually, I was thinking if you could make a mosquito repellent that would last for 8 hours, you'd
Oh,
be
yes.
a hero.
Yes, you can. I never thought about that.
Co-founder. Any questions? Okay, thank you so much.
Thank you.
Thank you. Right, so that was the final presentation today, but we're not done yet. So now the judges will go for deliberation, and probably they will choose the winner today, hopefully. So Sylvia, you are the only on-site judge today. Okay. There is a special room for you to get together with the rest of the team.
Virtual people?
Yes. Jen, could you please show the way to the conference room over there?
Just Stevia, just check your Telegram.
Could we say again?
Ask Stevia to check her Telegram.
Check your Telegram. Thank you. So now, pretty soon we'll have a networking part and the dinner part, which I don't know how about you, but I love it the most probably. So what we have now is an open mic. If you have a project that you would like to share, or a startup, or I don't know, you're hiring, or you're looking for a job, you'll have 1 minute to present your idea or need to the audience. So please feel free to come over here, grab some water. You have a minute to share with the world. Anyone? Any volunteers for sharing your project?
You need to stop sharing during the open mic.
Okay. You would like to share something?
Oh, I just want to ask whether anyone who specializes in
Sorry, I cannot hear you.
Like who expertise in eye exercise, like eye vision.
You have expertise.
No, I'm looking for.
Okay. If you would like to come over here and let us know. Here is the hot seat is here, so everybody can see you. Come over here.
They don't have to see me. Oh, I suggest that people can see me here.
Have you asked ChatGPT? Serious.
ChatGPT.
Have you asked ChatGPT?
No.
You probably can get some answer.
Oh, really? I see the people here are scientists.
Yeah, ChatGPT is a lot of scientists, right? ChatGPT access to all they have a lot of scientific experience.
I saw here is all like
a lot of open minds. So what is happening simultaneously?
Oh,
Getting about 30
I will just wait for the judge's decision over here.
Exercise for the eyes.
So this company actually is new,
For allergy,
but the product,
or
we developed the
it's more
product.
than this. It's just the topic I would like to discuss.
you mean for allergy or for?
Good beginning, good opening.
You are capability or you want the software disease device? Yeah, second investment.
Yeah, sure. It's like an eye exercise and also maybe.
Yes. I mean, this is like the short step, but I took on a lot of.
They can do the vision. For example,
Yeah.
a lot on the project. You should be in the business. Yeah. If you take your picture from a mobile phone every day of your eyes, you can just difference. There's a way you can use AI to train to see a difference. Yeah, like something like that. You take the eyes every
That's why I was surprised.
You can do also AVR.
Advanced sensor or just
Right now the phone is very good. You can even the iris, whatever. So you can trace every day, even every hour. Right? And you can have machine learning or AI to figure out. If you're interested in like you said, right? How to, but also just you can also do some exercise to see what's the negative event, how to improve your vision or whatever. It's much easier.
So you mean, I know there is one Beijing, but I don't think
have you, right now, more people is question of right? Improve your vision. Second, you do an edge. The orange, lay paper, right? Lay paper or orange they get another infection. So they want to want to do some eyeball exercise to improve the situation. So that's why you want to improve your vision or trying to improve like syndrome from like allergy or whatever.
Like what you said,
analysis,
like
basically.
maybe exercise.
Okay, hello guys.
There must be something that's being
I
held
don't
constant.
think
You've got some news for us, right?
Yes, we do. So I'm waiting for Sylvia to back to the stage.
Yeah, Sylvia's coming back.
So is Sylvia back? Okay, cool. Maybe Sylvia, you want to come to the podium?
What is?
Come over here.
What are the three? Excuse me.
Okay, so I'm going to start. So again, this selection process is more a community selection process. It's not a judgment of your startups. You have lots of different opportunities. I saw a greatness in every of you. So we just pick up something which more in line with our knowledge or our information at this stage and this moment. So again, so whoever not being selected, don't worry, and you still have plenty of opportunities down the road. So since we have three of us, I'm going to invite Sylvia to announce our winner.
Our winner. Well, again, I'm going to repeat. Everybody did an amazing job. I learned something that I didn't know. I mean, really cool, interesting talk about possibilities of afterlife on moon. Get to the point. We want to award presentation of Dorian Therapeutics for a number of reasons. So first of all, thank you for taking us through in 6 minutes the great achievement of the last 4 years. Definitely promising, spot on health extension, longevity. I think a lot of money goes into senolytics. You guys have done an amazing job going through first phases, and we wish you the best of luck with the clinical trials.
Thank you. We need a lot of that.
Okay, next one, I'm going to invite Ravi to announce our runner-up for today. Ravi?
Yes, hello. The runner-up was Hashiana, Eva Gallant for Hashiana. Very good presentation.
Thank you.
Okay, so we just realized that the two winners are both ladies. Very impressed. Congratulations for the two ladies. I also quite impressed. I want to highlight that both two ladies are non-native English speakers, just like myself, and I'm quite. I want to congratulate them for their achievement in states, particularly the Poland lady, only here for a few months. You're very, very brave, and we hope you can achieve your goal. We are not 100% sure the product can raise the money which you hoped, but we. And definitely quite impressed with what you have achieved in such short time frame in USA, and we wish you good luck and really hope you can be successful.
Okay, so the judges have made their decision, but it's not only them who decide the winner. We also have an Audience Choice Award. That means there may be a chance for other founders to win the Audience Choice Award. That will be, the winner will be spotlighted at Startup Founder World social media channels. So you can follow the QR code that you see on the screens, over there. And there will be a poll on Startup Founder World LinkedIn page. It will be open for 72 hours, so we have some time. You can ask your friends and colleagues to watch today's presentations and decide who is the winner after all. And after 72 hours, we will declare the Audience Choice Award winner on the website and in social media. Okay? So thank you so much for staying until this moment. So now we go for networking part, and for those who are on site, we've got a dinner. Thank you.
Bye-bye. Have fun.
Yeah.
Thank you so much.
It's McDonald's.
For the volunteer team.
Favorite spot.
Thank you, the volunteer team. Thank you, Gian, for having us here today. Thank you, online team. Thank you, ST. Thank you, judges.
Yeah. Thank you, everyone.
Well, thank you.
Thanks, Procopio, for having us today and for the dinner, actually.
Yeah, thanks, Joanne, for being the point person and doing such a great job.
Thank you so much. So.